Welcome back. The statistics, the burden, and the complications of hepatitis, they are all staggering. Joining us in the studio to debunk this issue and discuss further into the complications of hepatitis, especially in Nigeria, is Dr. Promise Udo Asogwa. He is a gastroenterologist, a hepatologist, and an expert endo endoscopist. I beg your pardon. He's joining us this morning on the studio to discuss these complications and the way forward. Doctor, you're welcome to the show.
Thank you. No.
Thank you so much for finding out time to join us.
Thank you.
So tell us, you are a gastroenterologist,
Yes.
a hepatologist, and an endoscopist. Now, what are the relationships of these expertise to hepatitis?
Well, the global burden of hepatitis is quite alarming, actually. And as a gastroenterologist, we are experts in handling everything that is related to the gastroenterology tract, from the mouth to the anus, and the adjoining organs like the liver and the pancreas. It's a very wide area of specialty in internal medicine. And as we said, liver, actually hepatology, hepa is the Greek word for liver.
Okay.
So hepatology talks about everything about the liver. So I think that's how we're all related. And then in endoscopy, like some of the complications of chronic hepatitis, like an advanced form of chronic hepatitis, we call liver cirrhosis.
Okay.
They could develop some complications we call varices, esophageal varices, dilatation of veins, especially those from the esophagus and the upper part of the stomach.
Doctor, could you be a little bit, use modern English? Like,
Okay. I mean the enlargement
so
of
that
veins,
the
blood
person listening to
vessels.
you would actually comprehend what you're saying. When you say
Okay.
esophagus, what do you mean, you know?
Esophagus is the truth.
Good.
So there are some blood vessels lining the lower part of the throat, and then also the upper part of the stomach.
Okay.
We know what the stomach is.
Yeah.
And such there are veins actually. Veins are blood vessels that actually
Supply blood.
take blood back to the heart for oxygenation and blood, and then gets back to the system. So in patients with some complications of chronic hepatitis, especially when they have cirrhosis, we call such complications varices. It means that the veins are enlarging due to so much pressure within the vein. Once liver is diseased, if there's advanced chronic hepatitis, we call it cirrhosis, the pressure within the liver will be high, and there's a major vein that supplies blood to the liver. We call it the portal vein. So the pressure within the vein will become so high, we call it a form of hypertension. We call it portal hypertension. So because the pressure is high, it will divert blood flow from these major veins to other veins that in other
Surrounding
parts of the
veins.
body. So these particular veins, we call them varices when they're enlarged. Once they rupture, once they break, they'll start bleeding inside. And that's why sometimes you see people vomiting blood and they say it's poison. Or maybe passing dark colors to they've been bleeding in the upper part of the stomach or the gastrointestinal tract, and they're now passing out such feces that are dark in color. We call that variceal bleeding or variceal hemorrhage. It's one of the most fatal complications of liver cirrhosis resulting from chronic hepatitis. So we have to go in there doing endoscopy. Endoscopy means we're going to pass a tube through the mouth.
What sort of tube?
It's like, let's say, a plastic tube with camera attached,
Okay.
and then you'll be watching it on the screen. So we see those veins, and once they are big enough, about to break, we have to tie it, we call it banding, to prevent it from rupturing and prevent the patient from bleeding. So that's the relation between the three.
So you've given very extensive explanation on how all of this work together. Now my question is this: hepatitis is a very serious issue,
Yes.
but has lacked the proper awareness and publication.
Yes.
What do you think would be the issue, seeing that Corona, Ebola, and all the rest has higher awareness, higher publicity, but hepatitis, which is a world issue, has less.
I think there are so many factors one could consider. Maybe the political will and, what I say, lack of proper awareness actually. And just like a country like Egypt, within 1950s and 1980s, there's this form of, the other form of hepatitis, hepatitis C, became prevalent in Egypt. And schistosomiasis became prevalent in Egypt. So schistosomiasis is a disease called bilharzia. So in their process to curb that schistosomiasis, they were doing unsafe practices, using unsterilized syringes to inject this and inject that. So because of that, they now introduced hepatitis C in Egypt. So about 6 million Egyptians were infected with hepatitis C in the late 90s and all that. So it became a national burden in Egypt. So they had to include the treatment, both the screening, investigation and treatment for hepatitis C as part of the national health program. So that at about last year, about 87% of Egyptians were diagnosed with hepatitis C, and about 93% of them were already treated. No, hepatitis C is curable.
Yes.
So I think number one, maybe more advocacy and government involvement will help in creating awareness amongst the people, so that people will know that this is a very terrible disease in the society.
Okay, Doctor, sorry.
All right, Doctor.
How many cases do you get per day as a doctor?
Wonderful. You know, I work in Enugu State University Hospital, and in fact, in a week like this, on the average, we get about 5 to 8 new cases of hepatitis infection, and we get about I don't think any week will pass without us getting about 2 or 3 cases of liver cancers related to chronic hepatitis.
Weekly.
So, weekly. In fact, once I leave this place now, I'm going to the hospital straight away because we have cases that I need to review this morning. Even before I came here this morning, I had to go to the hospital to see another case of chronic hepatitis that is really complicated. So the burden is much.
All right.
Yes.
All right. So, Dr. Asogwa, you work with the state teaching hospitals.
Yes.
Okay, so what would be, based on your expertise and experience, what would you say is the most common type of hepatitis that usually present in ESUT? That is the first question. And as a follow-up, what age bracket is most affected?
Very, very good. You know, just like we know there about, you know, the commonest form of etiology or cause of hepatitis in the environment is the viral hepatitis. We have A, B, C, D, E, and the A and E are actually fecal. They most times just end within the acute phase. They hardly progress to the chronic phase. But for B and C, you know, they usually progress to the chronic phase. And D, which actually goes along with the B, you know, these are the major 3 chronic cases of chronic hepatitis as related to the viral hepatitis. In terms of when we say acute or chronic, if the infection goes beyond 6 months, we say it's chronic hepatitis. So I did a study over a 10-month period, and I discovered in my study that the commonest cause of hepatitis, the study included ESUT and ESUT transplant and UNTH. Approximately 45.8% of all the cases of hepatitis that we saw were caused by hepatitis B. Then 31.9% was caused by alcohol. Alcohol. Then the rest was hepatitis C and the other forms of hepatitis like autoimmune hepatitis, and the one associated with what we call fatty liver or metabolic associated dysfunction liver disease.
Okay, great.
So alcohol is a factor, and even from the yesterday's interview that we've been having to educate people, alcohol has been coming up and has been coming up.
Yes.
But how come it's still in much more consumption, and why is it still a very much factor but still little knowledge about it?
Well, myself, I keep on wondering because people do not understand. Personally, I tell people that alcohol is one of the most dangerous biological poisons. That's what I tell my patients. Any alcohol anybody takes, the liver breaks down alcohol. There's an enzyme we call alcohol dehydrogenase. It breaks down the alcohol and converts it to acetaldehyde. And that metabolite or chemical is hepatotoxic. It's very toxic to the liver and a carcinogen. But I mean, it causes cancer.
Yes.
It's noted that that metabolite predisposes to cancer of the liver. In fact, at the time in Western countries, alcohol became the commonest cause of liver cirrhosis and all that. It's just now that what we call NAFID or MAFID is taking over and all that in Western countries. But in Africa, some part of Asia, and in sub-Saharan Africa, it's hepatitis B actually. But just like the study I did, alcohol is now the second etiological factor.
39%.
31.9%.
Second to viral hepatitis B.
Yes. So I think we need to create more awareness and let people know that alcohol actually is a carcinogen.
Yes.
In fact, I've lost count of patients that were lost from liver cirrhosis and alcohol-related liver cancer.
Yes, doctor, let me take you back just a little bit. I asked earlier, what age brackets are most predisposed to hepatitis? Because you find many young people in their prime coming down with liver cirrhosis. So is there an age predisposition to hepatitis?
Well, I will answer that by going back to the forms of transmission we have.
Okay.
We have the horizontal transmission.
That's from mother to child?
No, I mean amongst yes, the vertical transmission from mother to child, and then have the sexual transmission and all that. And it's been known now. In fact, a country like China, a study was done, I think 2016 or thereabout, and they discovered that sexual transmission was caused about 34.7% of all the cases of hepatitis B there. And even though we know that mother to child now, especially in Nigeria and Africa, is the most common mode of transmission now, but we see amongst young people, those that are sexually active. In fact, from the age of even 20, I lost a patient at 24 years, hepatitis C, which that led to cancer. From that range, 24 to 54 years, we see most young people and middle-aged people under this age, within this age bracket, coming down with hepatitis.
Doctor, I would like to ask, what has been your limitation when it comes to treating patients?
Actually, is the cost. Actually, it's not really cost effective. Well, initially, maybe 10 or 15 years ago, it was more of the antiviral hepatitis B, lamivudine, and all that. But because of the increased resistance to lamivudine, in fact, every doctor, everywhere, they just kept on prescribing lamivudine. And hepatitis B actually developed resistance to that, it's been noted. So, but later on, tenofovir came up, tenofovir diproxy fumarate, and then in 2018, tenofovir alafenamide came up. And then, the people usually complain about the costs. And before we talk about treatment, there are some investigations that need to be done. The panel test, the viral load, because you cannot treat a patient with hepatitis B without noting the viral load. And to undergo these tests, these are polymerase chain reaction-based tests, and they're very, very costly. Now it's around 30 to 50,000 before you now get back to the treatment. So hepatitis C now is just within the treatment range is about 3 months, but it will almost cost almost 400 or 500,000 for it to be treated.
Is there no government policies in place to help curb this?
That is the major thing, actually. Just like I talked about Egypt.
Yes.
That helped them to curb hepatitis C because the government got involved. So if God helping us, our leaders will get involved, I think it will go a long way to helping.
All right, doctor, before we get back to the policies and the government will, You mentioned, you listed a few drugs, antiviral drugs.
Yes.
That sounded a little bit like what they use to treat HIV. So my question to you is, can you use antivirals in that's for hepatitis in treating HIV?
Yeah, that's a good question. Though, yes, it's possible.
Because I had, sorry to cut your train of thought, I heard over time that sometimes the testing, the random testing kits that they use for hepatitis could read positive. And usually it doesn't mean the person has hepatitis. It could be another virus, trying to, and it reads
what they call
positive.
false positive results.
False positive results, yes, based on a viral load that is not of hepatitis. So is there a direct link in which you can use drugs for HIV to treat hepatitis?
No, these are viruses. There are some actually antiviral agents that could be used for blood infections, especially something like lamivudine and tenofovir. In some cases, about 1 to 2% of cases who have hepatitis B and HIV co-infection in a patient. So when such occurs, then that tenofovir, which could be used in both hepatitis B and HIV, will be very, very useful. They're all viral diseases, so it's possible. So, and we talked about false positive results. That is why we insist on checking for the viral load. Hepatitis
Which is more specific.
Yes, hepatitis B is a DNA virus. C is an RNA virus.
Okay.
So we must get the viral load and be sure. In fact, it's more like the confirmatory test. Once we see it's sensitive, then with other modalities involved, we can be able to assess the patient properly and know whether the patient could be treated or monitored over a period of time.
So the testing gold standard is PCR.
Viral load.
Viral load.
Yes.
Okay.
All right.
A patient has been tested and confirmed that he has chronic hepatitis. Is it possible for a liver transplant to help in such cases?
You're taking me to very, well, for HCP and all that, and trying to get a liver transplant, because if the liver fails and you transplant it again, you still be infected because it's in the blood already. You understand? So most times, for the C or B related, most times it's not really done actually. But for other forms of liver disease or things that could predispose to chronic hepatitis and all that, like alcoholic liver cirrhosis, transplant is actually the treatment of choice. If it's the one that's related to copper, we'll call it Wilson's disease or iron hemochromatosis. Some of those ones, liver transplant is the treatment modality of choice.
Okay. So, sir, what advice would you give to somebody who has confirmed that he's already infected and, of course, on treatment, but still feels like, especially for those that don't have symptoms? We know we've seen cases where people don't have symptoms, but probably they went to the hospital, got tested, and discovered that they were infected. What advice do you have for such person?
The advice I will give to them is to, first of all, once they've been tested and the test came out positive, they should be referred to gastroenterology specialists. We've had some cases where maybe general practitioners, other people trying to come into the treatment, and the outcome won't be all that good. So we insist. That's why in fact, we have a guideline from a SOGIN guideline, Society for Gastroenterology and Hepatology in Nigeria. We have so many guidelines. Is a guideline, American Association for Study of Liver Disease and all that. So we have this is a body, you understand, of gastroenterology specialists. They sat down and they brought out guidelines for treatment. And the guidelines actually will give a guide on how such will be managed. So if maybe at the primary healthcare centers or other areas or even other tertiary institutions, once somebody is sort of positive to either hepatitis B or hepatitis C, they advise that they should be referred to gastroenterology specialists
Yeah.
for the evaluation and treatment.
All right, Doctor. So very quickly and finally, before we let you go, because we know you're very
But
busy.
today is even my birthday.
Yeah.
Oh, happy
I was
birthday.
born on World Hepatitis Day.
Wow, you were born for this.
Yeah, you were born
My
for, you were
birthday.
made for this.
Congratulations.
Just like today
Congratulations.
was chosen because of Dr. Baruch Blumer.
Yes,
Yes.
yes,
it's-
we were told.
Yes, this was his birthday also.
Happy
Right.
birthday, sir.
Happy
Thank you, sir.
birthday.
Thank you, sir.
So we know we need to let you go to attend to your patients.
Okay, sir.
You're part of Sogin,
Yes, sir.
you're part of Enemy.
Yes, ma'am.
Yes, and I'm sure you're part of other associations that
Yes,
we may
ma'am.
not be aware of. So we know that there is need for government will and backing in pushing this awareness. However, is there any framework that is available, by you guys to push this awareness, to do your little bit, even in the local parlance, to give in your tenkobo, What is Sogin doing? What is NMA doing just to push this awareness?
I think I'll
people.
answer partly the one I know.
Please don't be political. Just
Sogin has really done a lot, so to
Okay.
say. And last year we hosted Sogin here, the 15th edition of the Sogin conference, and this issue of awareness still came up. A good number of members are part of some of these working committees with the government, like the prof that spoke yesterday. And in our little part on our own, whenever we have this kind of celebration, we organize awareness campaign, like in institutions of the
These campaigns, are they rolling or just one-off?
Normally, we plan ahead, you understand, get ourselves organized, and then some of these pharmaceutical companies usually help bring kits for screening and all that. Like on Thursday, we're going to have ours at Institution Hospital, Collier, where we consult. We'll create an awareness campaign, know how we can screen the whole community, and also get them to know about hepatitis.
That's fine. That's fine. Thank you so much. I'm sure the viewer out there has really gained a lot.
Thank
So
you.
it is indeed our pleasure. Hope to have you back some other time, but
Okay.
right now, time is not entirely our friend. All right, viewers,
Pleasure.
we'll take a short break. When we come back, we'll still continue the discussion. Stay with us.